Hello, so today let's talk about degeneration. Now, what is degeneration of the spine and joints? When you initially get the diagnosis of degeneration, when your doctor has told you you have degenerative changes in your spine or in your joints, it can be quite overwhelming to start off with. But and you might have been just dished out the diagnosis, and you don't know what it means in terms of your busy work schedule, your family life, and work travel, etc. Especially if you're a mom who's in a busy executive role and you have younger kids, all this can be quite overwhelming, right? So today in this video, let's talk about what is degeneration of the spine and joints. What exactly does this term degeneration mean? And does getting a diagnosis of degeneration means that you're stuck with it for life, or it's going to drastically affect your life? Let's explore all this in the video. So before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, and joint pain. I do this by giving you simple exercises, easy lifestyle changes, some tips, tricks, and hacks without taking away a big chunk of your time. And I also talk about some natural, non toxic products that have helped me in my own spinal and joint pain journey. So, without taking up more of your time, let's get into what is degeneration of the spine and joints. Now, whenever you have a piece of machinery, right, you use it over a period of months and years, there is some kind of a wear and tear that happens in the machine, right? It may still work perfectly fine, but there will be some amount of wear and tear. The same is applicable to your body, especially to your spine, and that is your back, mid back. Lower back, mid back, and neck area, and also to your joints. So, this video will cover a generalized degeneration about the joints and the spine, and if I refer to any specific conditions that arise from degeneration, I will explain that as well. All right, so just looking at my notes here, yeah. So if you look at your spine and your joints as they are used over and over again every single day, there might be some changes that happen. Now, these changes may be mild, moderate, or severe. I'll come to that, but the scientific explanation of degeneration is a gradual loss of normal structure and function over time. Yes, I did read that. So, this gradual loss of normal structure and function, the function part is very important. Let me explain this further. When you have degeneration of the spine, it can be really mild. Maybe you don't feel any pain or discomfort at all. And suppose, for example, you had a fall and you suspect you might have a fracture. So you went in and had an x-ray done and accidentally found out that you have degeneration in that specific joint. Whether you have that fracture or not, now you have the diagnosis of degeneration. So it can be so mild that it does not affect any of your daily activities. You don't even realize it. You don't have any aches and pains, or probably it's so mild that you are like, it's just a strain in my neck, and you move on with life. So it can be so mild, right? And it can be moderate as well, where you get your aches and pains, and you have had some kind of a x-ray or imaging such as MRI, or maybe your doctor has just told you, oh, these are just degenerative changes, and that is the reason for the aches and pains or discomfort that you have. And these are quite manageable. They might interrupt with your everyday activities. Say, if I climb flights of stairs, then I start to feel the pain in my knee. But if I'm walking on even ground, or if I'm just going up one flight of stairs, it does not affect me. So this is more like a moderate degeneration. Now, when it comes to severe degeneration, this is obviously of concern. Moderate to severe and severe degeneration is something that would be concerning, because severe degeneration, you will notice pain even without doing any activity. For example, when you're sitting for a long period of time, or when you get up from your sitting posture, you are standing up, you feel that ache or that discomfort in your spine, or a sharp shooting pain down your leg. So this can be all a part of severe degeneration. Now, it is very, very individual, because degeneration, say, if I have moderate degeneration and you have the same, our symptoms may be very different. So, you degeneration is a very big term that encompasses all of these that I spoke about, but it can be very different from person to person. So if I have a diagnosis of degeneration, it is not the same as your diagnosis of degeneration. So keep that in mind. So degeneration itself is just a process, a aging process that happens with the spine. Actually, having said that, the word aging is also very relative, because nowadays with the lifestyle that we have, and kids, they carry heavy backpacks or they're on devices, even 13, 14-year olds, their spine has started to show changes. So there was a study done on this, very sad, but surprisingly it can be seen in young teenagers as well. So if somebody tells you degeneration equals aging, take that with a pinch of salt. Anyway, coming back, I just went down a rabbit hole there. So, yeah, we were talking about severe degeneration. Now, severe degeneration or moderate to severe degeneration, it can affect you. For example, if this degeneration goes on and affects the disc, it's known as a degenerative disc disease, DDD. You might have heard about it, or your doctor might have spoken to you about it, or you might have read it on your MRI reports. So, when you have DDD, the disc is affected, and that will lead to back pain, or you might have some narrowing in your spine because of the degeneration. That will be known as a stenosis, say spinal stenosis, which can be in the neck or mid back or back area. Or it can be possible that you get the sharp shooting pain, which are nerve pains down into your arms or legs. For example, if you have degeneration in your lumbar spine or your lower back, and it is compressing or irritating the nerves in that area, if it compresses or irritates the sciatic nerve, this is known as a sciatica pain. And if you're looking for more details on sciatica, stenosis, disc issues, etc., I have done a lot of YouTube videos on these. I will not go into the details here. However, you can go to my YouTube channel or just search my name on YouTube, so Swati Prakash, sciatica or disc issues, and it'll come up for you. You can have a look at those. Now, if you want to learn more about degeneration of the spine and joints, you can have a look at the blog that I have written on this topic. And within that blog, I also talk about three simple tips that you can help yourself, and I mean use yourself to reduce the effects of degeneration. I also talk about free 11 days program that I have done that has helped me a lot with my back and neck pain because of the degenerative changes that I had in my spine. Anyway, all that will be in the blog. So what I'll do is I will leave a link to that blog in the description of this video. If you're watching me on Instagram, you go to my bio and click on that, and the blog details will be in there. Alrighty, I hope this was useful and it gives you some insight about what is degeneration, and you don't need to be scared of this diagnosis. You don't need to be overwhelmed. I know easier said than done, but if you have the knowledge and you know what you need to do about it, you can cope up better. And instead of being scared about it, you can actually do something about it. Alrighty, I'll see you guys next time. I hope this was useful for you. Bye for now.